Hi,
I'm Lauren.
and I'm Alex.
And we're two friends who moved out of the big city to see what the small town life was all about.
We're passionate about health, wellness, relationships, and the entrepreneurial spirit.
Listen in weekly to hear all the wild details.
This is That's Wild.
That's such an aha thing to
Yes.
hear. I mean, that's so important because I think you're so right. I mean, we've been vocal about this on this podcast, but I'm dealing with multiple autoimmune diseases. I don't know if you maybe have been diagnosed or think you have some, but and what I'm learning is that they're chronic and that they cause a major breakdown of, they can lead to much more severe things like cancer, and I never thought that before. I'd heard people say like, oh yeah, I have Hashimoto's, or I have this autoimmune disease and this autoimmune disease. And it wasn't until I started learning like, okay, that's a really big signal that systemically you are having a breakdown. Something
Yes.
is really wrong here. And it's also very hard to get those under control and get relief from those autoimmunities. And so I think that's so important. That's kind of where I've gone with my thought process with anything foreign, going into a body. We just recently had somebody on the podcast talking about her explant surgery. She had implants put in and, a foreign body put in that I don't even think she cared that much about what could go wrong because she just really wanted them. And she thought everyone
Right.
has them, and within a year, systemically, she just went down. And she, at that point, was like, I'll do anything to get these out. I don't even care. And it's not until you have that type of chronic, that kind of toxicity load in your body that you realize, I might not survive this. I mean, she said that she was waking up going, I don't know if I'll breathe. Like, I don't, it was that severe. And it's disappointing that we don't have this information readily from just our general GP or clinic. I think it's so important that, like what you're talking about, is you did the research. I know we have lots of doctor friends that said before, post-COVID or pre-COVID, they weren't researchers. They did what they were taught. And they weren't taught to really look into this. Yeah. They were taught, if you don't get inoculations, these kids are going to get all these diseases. And it's the right thing to do. And it's, they weren't taught to look into, why are infants getting vitamin K shots as infants? I mean, why? And what's in them? And, all these things. And now I think it has opened up so much thought and research, even with practitioners like yourself.
Mm-hmm. Yeah. And initially when in 2021, primarily, when I saw that there was already a significant blowback in my patient population against the COVID vaccine, which was kind of trickling its way over into the other immunizations, and people are asking more questions and kind of more suspicious of all the other vaccines that we give, I initially thought, oh, this is bad, because now we're going to have a huge jump in unimmunized children and an increase in infectious diseases because of this, which is kind of what was expected, but hasn't really happened, thank God. But I thought of it as a negative thing, and the further away I am from that, the more I'm thankful for it and think of it as a positive thing, both for for my patients, my patients' parents who are doing the research, and they are reorienting the entire way they think about health and their children's health and immunizations. And then for providers, there's a small percentage, but thankfully a vocal and I think powerful and positive percentage of healthcare providers who are rethinking everything and coming to a lot of the same conclusions. And that is very encouraging to me, because sometimes it can be lonely in the fight, and to keep hearing about others whose eyes were opened is really encouraging. So yeah, but vitamin K is another good illustration. It's one of those things where we give it for a really, really good reason, because if we didn't give it, rarely, but sometimes a baby who whose blood clotting system isn't working well in the weeks right after birth can have a catastrophic bleed, and if it's in the brain, it can cause lifelong severe brain damage. It's rare, just like all the other, vitamin K is not an immunization, but the immunizations we give, we're preventing very rare diseases, and we're doing it for a good reason, and we convince ourselves that the side effects aren't worth worrying about. And so we do it to prevent something very rare but very serious, and we think that we're not causing harm, but in the end, we are causing harm. And so something as simple as the vitamin K, which is a great idea, if it's got aluminum in it, we shouldn't be injecting that into newborn babies. By no means should we be injecting aluminum, which is neurotoxic, into newborn babies. But when you get ushered into this system in your training in med school and residency, and you always think that you're saving lives with these things, and you never stop to really consider, or even if the other side exists, the good evidence on the other side exists, but you don't have the time, or nobody challenges you with that, or you don't even allow it to filter into the real thinking parts of your brain and your heart, then you don't even consider, well, maybe I'm doing harm. Maybe we're causing more harm than the good that we think that we're doing. And the vitamin K shot is illustrative. Yeah.
Mistake,
Yeah.
right?
Yeah, we don't realize we're breaking our oath. So much of the time we don't realize it. But one of the things that I've told my patients since COVID is, prior to COVID, I think that we were, wise enough to have an implicit trust of the system and an implicit trust of the immunizations that we were giving to kids. But since COVID, I think that the wisest thing is to have an implicit mistrust of the immunizations, mistrust of things as simple as a vitamin K shot at birth, an implicit mistrust of the system. And moving forward, if we do that, and we start, asking providers, will you prove this to me? Will you prove that this isn't causing any harm? Will you prove that this is necessary, truly necessary for me, my health, my child, my child's health? Make us prove it. Make us give you the information. And a lot of times you're gonna come to an impasse because providers don't have the time to really prove it, or they won't take the time. But that also gives you a really good idea, well, can I trust this person or not? If they won't talk about it, if they won't do their own research, if they won't rethink it, if they won't question at least a little bit, then you shouldn't implicitly trust them. And maybe you should just move on and find somebody who will answer your questions.
Well, let's talk about that a little bit, because I think that the reason that I decided, we were already going to you before, but you took a little time to get your direct primary care business up and running. And let's talk about a little bit about how with direct primary care, you do get a lot more time. You get to ask these questions. Because that's a big reason why we went the direct primary care route. Obviously, we loved you, but what are you getting from that as a parent, as a patient, that's different from a traditional practice?
That is a great question, and there's a lot of good answers to that. I think one of the simplest ways to put it is that, at least for primary care, direct primary care, or DPC for short, is the answer to almost all of the things that are broken in the healthcare system as it now exists. The way that it's able to do that, the way that we're able actually to restore the doctor-patient relationship, to restore the time that we need with our patients, to educate them, to listen to them and hear what they're saying, and get to know them better, is the fact that it's a membership-based model, and that we it's cash pay, so we don't deal with insurance, so we don't have to serve those masters, and we're able to keep our practice small. And so for family practice doctors, their usual patient panel is about 400 to 600 patients, whereas the traditional medicine model with insurance is going to be 2,000 to 4,000 patients usually for each doctor. And for pediatrics, it's even smaller. It might be 200 to 400 patients in a doctor's panel. So that gives you plenty of time with your patients. Basically, you see about 1% to 2% of your patient panel each day in the clinic setting, and so you might see 5 to 12 patients in a day, and that gives you 30, 45 minutes to an hour with each patient, which is what patients want, and which is really the best way to take care of patients. If they don't feel like they're rushed, you don't feel like you're rushed. And it's a wonderful way to practice. I can't stress that enough. I had heard about direct primary care probably around 2015 or so through an organization called Citizens Council for Health Freedom, or cchfreedom.org, and they created a network called the Wedge, not just for direct primary care, mostly for cash pay practices that upheld certain kind of core principles of healthcare freedom, which means, we don't deal with insurance, and we don't sell your information, your healthcare information, to the government or anyone else through electronic medical records. So they've had that network for a long time, and way back when I first heard about it, it was kind of like a dream. It's like, gosh, I would love to do that one day. I don't know if I'll ever get there. If I do, I have no idea how I'll get there. But I think God has a way of pushing us along and taking us where He wants us to go, bit by bit, sometimes quickly, sometimes slowly. COVID was kind of a quick way of transitioning, but I had heard about it, about 7-8 years prior. So I knew kind of where I wanted to end up, where I wanted to land in the healthcare landscape if I left the traditional system. And so I took a little time to start my practice. I wish I could have transitioned more quickly, but these things happen for a reason, and I'm so thankful that I've been able to start Independence Pediatrics.
Well, and I think it's important, like you said. I don't think we think about that often, but if you are in like the traditional pediatric office or whatever, they do have all of your kids' medical records and all of your, the government can have that. I mean, anybody can really have that, right? I mean,
right.
How do they have they have access to that?
Yes.
If they need it or if they want.
Yeah. So the interesting thing about HIPAA, which came about in the 1990s, Healthcare Information Portability and Accessibility. I can't remember what the last A stands for, but it was ostensibly created to protect our private healthcare information, or PHI. But what it essentially does is it allows the government to data mine all of our healthcare information in any electronic medical record system that exists on the planet. No matter if you went to an urgent care for one visit, an ER for one visit, or with your primary care doctor that you've been going to for decades, if you sign the HIPAA form that they essentially require you to sign, you don't have to sign it, but most people sign it, they don't think twice about it, then that basically gives the government the freedom to data mine your healthcare information. So when they do so, and they do it all the time, they have done it on your healthcare information, they've done it on mine. Anybody who has their healthcare information in an electronic medical record, it's been data mined by the government. So when they do that, they say that they mask your identity. So they take your unique identifiers, your name and your date of birth and your social security number and any medical record number, and they black mark over it, so that you're not identified when they data mine it and when they use it for research. But, really, do we trust that that is exactly what they're doing? They don't have a database that has all our names and date of birth and information, medical record, address and everything else otherwise. So we can say we trust them not to have identifying information in there. And I'm not going to be paranoid about it because that ship has sailed for most of us. But that's what they're doing. So they're doing medical research on us without our consent. Well, I mean, we signed the HIPAA form, but we certainly didn't say I consent to be a part of any number of studies that they want to do with my healthcare information. With
And so
our
I'm
medical
just
record,
curious. No, go ahead.
well, with our medical record, we don't have patients sign a HIPAA form, and we don't share it with anyone.
Okay.
So we don't
I'm
have
just curious,
that conflict.
is it because like in direct primary care that you're not utilizing the insurance system? Is that why it can be private? Is that why
Yes.
everything can just be in your, okay.
Yes.
So that's a whole nother podcast.
Right,
But
yeah.
I think that is so out of control at this
And
point.
that does bring up a few questions that I use an electronic medical record, which I'll give a shout out to atlas.md. There are some, really kind of groundbreaking, trailblazing people in direct primary care, one of whom is Josh Umber and his partner up in Kansas City, who started a direct primary care family practice a clinic back in, I think, the mid-teens. And they decided to create their own electronic medical record, Atlas, which is what I use. They realized that we had totally different needs, and we didn't need to be sharing our electronic medical record data with anybody but besides our own practice and our patients. And rarely, if they have insurance, sometimes we do need to share some things with them. And so they created the electronic medical record just for their purposes, and it's a wonderful system compared to everything else I've used, whether it's in the Army or all the way through all the other systems that I've used over the years. It's wonderful, and it's so simple and so straightforward that even if you're uninitiated and you go to your electronic medical record, if you looked it up as a parent, you would be able to go through it and find things that were important and be able to make sense of it. Whereas all the other systems, it's it's horrible just to find something simple. We thankfully I don't have to worry about it. I don't have to worry about anybody else knowing my patient's medical history. If I don't want them to have it, they don't have it.
Awesome. So I guess kind of getting in closing a bit here, what are your actual thoughts and feelings about how you used to practice medicine traditionally versus now?
Yeah, so for me, what I really would like to do is become more of a naturopath. And I'm, I think that, like I said, the learning curve that I have right now in trying to do things naturopathically, or not just, there's an instinct that we have when we're part of the system. When we see a patient, I'll take a look at their medical record before I go in and see them. I'll review a previous note. I'll look and see what they're coming for that day, and I'll know what their complaint is. And when I walk in the room, particularly with a sick visit, within a minute or two, you know exactly what's going on, and you more or less figure out, well, what am I going to need to do for this? And you don't do that arrogantly. It's just you become efficient, and your responses, because you've done it so many times, are almost instinctive, pre-programmed, just by experience. And you do things the way you do things, and that's the way it goes. Whereas now, I check myself, because if I do that with my patients now, for one, I'm not giving them the time that they need or the focus and the attention. So I've tried to always fight that. But also when it comes to, well, if I see a kid with a cold, do I just prescribe cough and congestion medicine? Well, I know that it helps, but is that really the best thing for my patient? Maybe we should consider some alternative therapies for cold symptoms, something that's more natural, something that has less side effects, something that is safer. Even though I consider them safe, there's things that are even safer. And so what I find myself doing a lot of the time now is after I see a patient, I'll do a little research and say, and just search, well, what are some naturopathic remedies or alternative treatments to what traditional medicine would offer for this. And, if my patients are willing to be patient with me, which most of the time they are, and I'm very thankful for that, then I just get back to them and say, hey, why don't we try this? Here's something else that we can do, rather than, the instinctive thing we do, which is make a diagnosis and prescribe a medication. So that's a big part of it. I really do think that I need to do some training in naturopathic medicine. So I will, that's on my list. So that's on my list of
I love
things
that.
to do.
For people listening, I just love that you can say, you've practiced medicine for many, many years. You've been a pediatric doctor for 13, 14, 15 years, and that you're still saying, okay, now that I'm continuing to learn, there's still areas where I can be trained. I'm still learning. I'm still looking into that. And I think, like you said, when you're programmed into a system, I think you don't have those thoughts anymore. It's like, you got to get through the patients. You got to get. So as a parent, I so appreciate a doctor who's like, I'm going to continue learning. I'm going to continue Sherlock Holmesing this instead of just prescribing.
That's what most doctors do.
Yeah.
And like a total shout out to my patients, the wisest physicians learn from their patients, and sometimes we learn the most important things sometimes in our career from our patients. And for instance, I saw a patient who wasn't even a member, she had a sick kiddo, and I did a house call, and she said, hey, have you heard about the podcast series A Shot in the Dark by Candace Owens? And I was like, well, no, I haven't heard about it. She said, hey, it's really good information about immunizations from another perspective. I'm like, okay, I'll take a look at it. So I went and I listened to it with my wife, who is a retired pediatric ICU nurse, and it was so fascinating and so right on and so helpful for me. And it's at one point it's delightful, it's wonderful to learn another perspective, especially when you know that it's true and you know that it's the best thing for patients. And then the other side of you is going, man, what have I been doing all these years? But I cannot thank that mother enough for sharing that with me, because that kind of kick-started my journey into looking at all the immunizations that we give to kids on the CDC schedule and rethinking them. And so that's my real focus in re-educating myself right now. And then, like I said, I'm going to probably move on to naturopathic type stuff. But I really want to learn from my patients. And so in the kind of practice that I have now and the kind of practice that I helped in Tomball, Rife Pediatrics, that's a direct primary care, we get a patient population that's using naturopathic remedies. And so I learn a lot from my patients, and hey, I never knew that you could use this for an ear infection or what have you, or this for a tummy ache, or this for a headache. And that kind of stuff is really helpful to me, and I can pass it along to my patients. I can do my research on it to make sure that it's something that I can really endorse. But I really love practicing that way, and I hope that my patients don't mind me learning from them. I don't want to always be the expert and say, well, you can do it this way, or you can find another doctor. I never want to be that kind of guy. I don't want my patients to always take my word for it even. Ask me tough questions, challenge me. I say, we can take this antibiotic, doctor, but I heard that we can try this. I'm like, okay, well, let me look into that. That's the way I want to practice now. I want to learn from my patients, and not do the knee-jerk kind of Western medicine approach of just making a diagnosis and prescribing something, moving on to the next patient. So.
I'm curious. I definitely want to know, because I see this all the time on Instagram, but I'm like, is this really true that doctors get paid by insurance for every child that's fully vaccinated, including the flu shot?
Yes.
And so for every vaccination, they're paid more.
Yeah. It's, the funny thing is when you're doing this, when you're in the system, I'm getting those kickbacks, right? But they never come to you, like the accountants never come to you, the office manager, they never come, and they don't come and and have a little meeting with you and you say, doctor, I want you to know something about the financials on your practice. You generate hundreds of thousands of dollars every year in charges to insurance companies, Medicaid and otherwise. And of course, we have to pay our overhead, and you get your percentage, and you know what your bonus structure is, you know what your incentives are. But let's talk about vaccines, because maybe you didn't know that, if you don't follow the rules, you're getting nothing. But if you follow the rules, you might generate $100,000 to $250,000 more every year for your bottom line. Well, your gross receipts by having a really high percentage of your patients be fully immunized. They never say that, but that's exactly what they're pushing you towards it. The nurses, and they're training the nurses. They never tell the nurses what we're really doing and what the real motivation is behind it. But they're training the nurses, they're training the office staff, they're training the people that answer the phones. Hey, does your kid need any shots today? Or are they up to date on their shots? Let them get it. Let us get them in so they can get up to date on their shots. And so everybody's obsessed with shots, and we think we're saving lives, right? And what we're actually doing is we're, getting a big bonus paycheck for ourselves and our corporation and growing the machine. Yeah, and they never tell you that. You're going along with it. I thought I was the doctor. I thought I was making these medical decisions for my patients, and all they really want me to do is go along with the system as best I can, check all the boxes in the electronic medical record, do all the compliance, so that the insurance companies are happy. My insurance companies don't care anything about my patient's health. They just want all the boxes checked. They want their big paycheck. Ugh, my goodness. It's so disgusting. But yes, just within the past few days, I was listening to somebody who was saying, yes, a doctor can make $250,000 a year extra in bonuses from insurance companies by having their patients fully compliant or up to date on their immunizations. Now, I don't have that verified, but that wouldn't surprise me for a second. Not for a second.
Yeah.
Especially now.
Well, and COVID. I will say, and I've said this, but I will say, when we were at the clinic after Dr. Husmann left, and we were with the PA, and I said I was scared because of, and I will say I learned almost everything I know about the immunization schedule through a shot in the dark. And I want to point out, we know that Candace Owens is not a doctor. She backs it up with all kinds of documentation, and you can pay to see it, and it's real, you guys. But that's where I kind of learned about it. But I was so scared to make the decision not to, and that's just our personal choice for our family. My oldest son is fully vaccinated, but it was just my personal choice when all this new knowledge came to light that I started learning about. Anyway, and when I did that, a person at the clinic said to me, you can make that choice, and we can let you still be here if you want to make that choice. As if I'm not choosing my own doctor. They're choosing to have my children. Yeah. And she said, but do you know what polio will do to your daughter? And it hit me right in that moment. Like, how dare you say that? But when I have the knowledge, right? But she wanted to make me so afraid that I would just say, you know what, you're right, do it. Put it in her, Yeah. And I think that, and I had talked to you, and you said, you got to give them grace, though, because they really believe.
That's all they know.
That they really believe that if you don't do it, your child is at risk of getting polio, when we know now that where is a polio case documented in the last how many years? But
it's been about 30 years. about
Yeah,
30
and
years
that's what they
in
believe.
America.
Right. So I appreciate, because I can't imagine what it's like to be a doctor in that system and see children day in, day out, and sick kids and things like that. And not step outside the box and go, well, hold on. I can imagine that it's very difficult to step away from that type of practice because of how you've been programmed.
So props to you.
Yeah.
Thank you. Thank you.
And thank you so much for joining us.
Yes. I mean, is there any way for our listeners that they can find, and I do want to ask, do you do teledoc appointments? Are you only local right now? Will you go, outside of Texas or?
That is a great question. Just last week, I got a call from a mom in Northeast Tennessee who had found me on a website, the FLCCC website, where I have my information so that I can help people with COVID if I'm able. But in terms of practicing medicine, I can only practice medicine in the state of Texas because that's the only place I have a license. But I was able to help her, and I was able to direct her to somebody in her area who could help her. And I love being able to do that. And even though my practice is a membership-based practice, and really long-term, that's the only way I'm going to survive is if I have lots of members. My bottom line is I want to be able to help anybody that needs help that I can help. And so I can do telemedicine for anybody in anywhere in the state of Texas. I can help them, and I'm happy to help them. And they can find me on my website, independenceped.com. I certainly want to be available for people in my area who aren't necessarily ready to become members. If they just need a doctor visit for their kid, for whatever, I want to be available to help them. In fact, I just posted something about that on my Instagram and Facebook today for back to school issues. So, if your kid needs any back to school things that I can help with, just give us a call. So I'm on Instagram and Facebook, but I don't keep them up very well.
And it's all under Independence Pediatrics, right?
Independence Pediatrics for both. And then of course my website, independenceped.com, and thankfully you can Google Maps search me and find me that way as well. So
awesome. Well, thank you so much, Dr. Husmann, for joining us and being on here with us today.
Yes, thank you, ladies. It was delightful.
We really appreciate it.
I really appreciate the opportunity. Thank you.
Thanks so much for listening to another episode of That's Wild, the podcast with Lauren and Alex. I am so excited to keep on going with this podcast because it's like our weekly girls' night in, and you're invited to the most fun-filled chat about the wildest stuff happening out there. Think of us as your BFFs who spill the tea on all the crazy things you didn't even know you needed to know. And just like the awesome friend you just heard from, we've got a lineup of fabulous guests waiting to dish out the juiciest stories and the coolest, inspiring information. We just want to leave you inspired, motivated, or simply mind blown by something that'll have you texting your friends like, "Did you know this?" Now, here's the deal, lovely listeners. We want to hear from you too. So grab your phones, slide into our voicemail with your thoughts, questions, or even your own wild stories. And if you've been having as much fun as we are, why not share the love? A 5-star review is like the best virtual high five we could ask for. Don't forget to hit that follow button so you never miss out on our weekly girls' night. You don't want to miss it. Thanks for joining us today, friends. Until next time, keep it fun, keep it fabulous, and keep the good vibes flowing with That's Wild, the podcast.